Good afternoon, everyone, and welcome to the FY 2021 Ryan White HIV/AIDS Program Clinical Conference. I am Laura Cheever. I'm the Associate Administrator of the HIV/AIDS Bureau, and we administer the Ryan White HIV/AIDS Program. So welcome to you all. I'm sorry we are doing it virtually, but we decided that it was really the best course of action. I am also pleased to introduce my two co-chairs, Allison Agwu, who is a professor of pediatrics and adult infectious diseases at Johns Hopkins University. Congratulations, Allison, on that recent promotion.
Thank you.
And to Michael Saag, who is the perennial co-host of this event with me, the Associate Dean of Global Health at the University of Alabama, Birmingham. So welcome. So today, the purpose of the conference is, I'm hearing some feedback. I don't know if all of you are as well. But the purpose of the conference is really to provide an advanced training for practitioners in the Ryan White program who are caring for over half of all the people living with diagnosed HIV in this country. The format includes state-of-the-art lectures, very popular case-based panel discussions, and two interactive small group breakout sessions. We are also very excited this year that we are welcoming fellows that are participating with the Pathways program. So in terms of who is attending this conference, you can see here on the left, when we look at the number of patients under direct care, that most people here are actually caring for quite a few patients, and yet we find for many of them, this is their sort of their most important HIV training of the year. And we look at who has attended this conference. I am really excited that we have majority of people have attended 5 or less. We are really excited in getting people new to HIV care, and we're glad to see that we have new people coming in participating. Overall, we have about 650 participants. The majority of those are doctors and nurse practitioners. In terms of where we are from, this is one way of looking at the data. We have a representation from California, Florida, and Georgia in particular. Next slide. And the funding for the conference. This conference is funded by the Health Resources and Services Administration at the U.S. Department of Health and Human Services. And it's done through a grant to the AIDS Education and Training Center's National Coordinating Resource Center at Rutgers University, with a subaward to the International AIDS Society USA, who is sponsoring the CME for this event. Next slide. So the AATCs, if you do not know them, it's an important part of the Ryan White HIV/AIDS program. We fund 8 regional centers who fund local performance sites in every state. We also fund 3 national centers and 2 health professional training programs to really integrate the national HIV curriculum into training around this country. Next slide. So IAS-USA, the mission of the International Antiviral Society USA is to improve prevention, treatment, care, and quality of life for people with or at risk for HIV and other viral infections through providing high quality, relevant, balanced, and needs-oriented education and information. Really, they're able to bring together the thought leaders to do training of practitioners across the country. Next slide. So I said we have 3 co-chairs, myself, Allison Agwu, and Michael Saag, who will all be participating today. I'm now going to turn it over to Allison.
Thank you, Laura, and my pleasure to be here with both you, Mike Saag, and everybody else. And so first, I think careful to mention that we get CME for this. You can get up to 14.5 on Canadian medical education credits for this conference. And remember just to put for the credit that the activities you actually engage in. But also excitedly, we get credit for a large array, both ABIM credits, nursing hours, and many others. And so an opportunity for you to engage, but also to get credit towards your certifications. Next slide. And financial relationships are really important for us to know what relationships they have, and those are available in the e-syllabus book, and each speaker is required to have those prior to each presentation. Next slide. And importantly, the idea for this is, while you're here, the idea is that we then share with others. So the slide training guide will be available after the conference, and the idea is that you share with those who are unable to attend this conference. We keep paying it forward and sharing it forward. Next slide. Importantly, this is not meant just to be us talking at you and the faculty to talk at you, but for there to be exchange. And so really do use the Q&A box. You'll always have a moderator for each talk. And we do want to make sure we're hearing your thoughts. There's lots of chats as well. We'd like to see that dialogue, but definitely put your Q&A questions in that Q&A box, which will be monitored, and we'll get through them as much as we can. Next slide. Again, the chat feature, really critical. A lot of really fun stuff happens in the chat, but do try to keep your questions in the Q&A so that you don't get lost in the chat and the chatter. And importantly, I love polls, because polls really give us the pulse of the audience, what you're thinking. And it's not just to say there's a right answer or a wrong answer, but to know where people are. And so please do answer the polls in the poll screen and not in the Q&A box, to make sure that we have an opportunity then to educate or to talk through where we are in terms of polls. But do answer them. It's nice to see 100% of the poll questions when they come up. Next slide. I'm gonna hand it over to Mike Saag.
So my middle name, I think, is polling, so I get to do that. So how many individuals with HIV infection are presently under your direct care? Not how many are in your clinic, but how many people are you taking care of? The box should be popping up. There it is. Go ahead and vote. We'll cue the music. If you can name that tune, you're much better than me, because I ain't got a clue. Okay. And it looks like the majority of folks listening, as we expected at this meeting, are very experienced, taking care of it on average about 100 to 300 patients each. Next. So let's go to the next slide, thanks. How many prior Ryan White clinical conferences have you attended? There's been 21 by count. Some of you, this will be your first, and some of you maybe have attended all 21. That's good. Okay, let's see where we are. Name that tune in 4 notes. So the majority have been to at least one, with a plurality of around 1 to 3. Great. Next slide. The National Ryan White Clinical Conference on HIV Care and Prevention is on August 23rd to 26th, 2022. When did you participate in this conference? Did you participate immediately before the national conference, after, same time every year, early December? Go ahead and vote. Next. Okay, so you prefer to have this meeting before, after, same time as we are right now? Looks like folks want to sort of have it the same time. Sometimes we have it before the national conference, sometimes after, but I think it sounds like we want to have a separate meeting, and that's great. Hopefully it'll all be face to face. Next slide. All right, so this is a lot of you participated. That's great in the pre-knowledge activity practice assessment. You can see that we as a group didn't do so good, but that's okay. These questions were all targeted to what we're going to be hearing about during the conference. We have about a 20% or 19% pass rate, so we'll do much better than that, I'm sure, by the time this is all said and done. Next. And here's our agenda. We've started with the introductions. We're going to hear an update from the HIV/AIDS Bureau from Dr. Cheever. Have a little Q&A, and then go to Dr. Judith Currier from UCLA for new and investigational ARV drugs and strategies. Have a Q&A, then take a break, come back, and update on COVID. And that'll be a very nice update that'll bring us to maybe some of the newer drugs that just got released or just got announced this past week. Q&A, then we'll have Wendy Armstrong talk about challenges and opportunities for telemedicine. Q&A there, have some closing remarks, and then have a really special session that'll be 40 years of progress, looking back at the beginning of the HIV epidemic. Why are we doing that? Because the beginning was here in San Francisco as well as other places, but most notably, 40 years ago in 1981, there was a huge outbreak that started with HIV and AIDS that really preceded 81. So we're bringing back some of the pioneers who were here at that time. We're going to hear their stories. And we figured that a lot of folks who are in the current field of AIDS therapy right now, you might not even been born then, right? Or that you started practicing well after that. So looking back, we're going to hear what their experiences were. We're going to learn what they learned from their experiences. And importantly, towards the end, we'll translate that to what about other pandemics like COVID? How does that instruct us for how we can deal with it? So it promises to be a great session. It'll go starting at 3:30 here on the West Coast. That'll be 6:30 on the East Coast and time zones in between. So we're getting ready to start. Here we go. Our first speaker, as mentioned, is Dr. Laura Cheever, who's a co-host of the meeting and the director of the HIV program at the HHS. And she's going to give us an update on the Ryan White program. Laura?